Indapamide is a medication that is used to treat high blood pressure and to reduce extra fluid in the body caused by heart failure. It belongs to a class of drugs known as diuretics or water pills, and works by causing you to make more urine, helping your body get rid of extra salt and water. This can help prevent strokes, heart attacks, and kidney problems. It can also lessen symptoms such as shortness of breath or swelling in your ankles or feet. It's important to take the prescribed dosage at the same time each day, and it's best to take it in the morning to avoid having to wake up frequently during the night to use the bathroom. Be sure to follow your healthcare provider's instructions for the best results. When taking Indapamide, it's important to follow your doctor's instructions. Usually, it's taken once daily in the morning, with or without food. If you take it too close to bedtime, you may need to wake up to use the bathroom, so it's best to take it at least 4 hours before bedtime. The dosage will depend on your medical condition and how you respond to the treatment. It's important to take this medication regularly to get the most benefit from it. Try to take it at the same time each day to help you remember. Even if you start feeling better, continue taking it as prescribed. It may take several weeks before you see the full benefit of the drug. If you also take certain medications to lower your cholesterol, like cholestyramine or cholestyramine, make sure to take Indapamide at least 4 hours before or after these medications. And remember to keep your doctor informed about how you're feeling. Let them know if your condition doesn't improve or if it gets worse, such as if your blood pressure remains high or increases. Some common side effects of Indapamide may include dizziness or headache. If these effects persist or worsen, it's important to inform your doctor or pharmacist as soon as possible. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Indapamide may cause dehydration and electrolyte imbalance. If you experience symptoms such as extreme thirst, very dry mouth, muscle cramps or weakness, fast or irregular heartbeat, confusion, or decreased urination, it's important to notify your doctor immediately. If you experience any serious side effects such as a decrease in vision or eye pain, it's important to seek medical attention right away. While a serious allergic reaction to this medication is rare, if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing, it's important to seek immediate medical help. It's vital to note that this is not a complete list of possible side effects. If you notice any other effects not listed, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Indapamide, it's important to let your doctor know if you have any allergies, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have diabetes, gout, kidney problems, liver disease, or lupus. Indapamide may cause dizziness, especially when combined with alcohol or marijuana. It's important to avoid activities that require alertness until you know how this medication affects you. Also, be mindful of sweating, diarrhea, or vomiting, as they can increase the risk for dehydration. Make sure to drink plenty of fluids, unless directed otherwise by your doctor. If you have diabetes, Indapamide may increase your blood sugar levels. It's important to monitor your blood sugar regularly and report any symptoms of high blood sugar to your doctor. Additionally, this medication may decrease your level of potassium in the blood. Before using potassium supplements or salt substitutes containing potassium, consult your doctor. It's also important to limit your time in the sun, as Indapamide may make you more sensitive to sunlight. Use sunscreen and wear protective clothing when outdoors to prevent sunburn and skin damage. Lastly, be sure to inform your doctor about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's crucial to discuss the risks and benefits of using Indapamide with your doctor before continuing with this medication. Before taking Indapamide, make sure to consult with your doctor and pharmacist about any other medications or herbal products you may be using. It's important to keep a list of all the products you use and share it with your healthcare providers to avoid any potential drug interactions. Some products, such as dofetilide and lithium, may interact with indapamide, so it's important to discuss these with your healthcare providers before starting this medication. Additionally, certain products may have ingredients that could raise your blood pressure or worsen your heart failure. Be sure to inform your pharmacist about all the products you are using and ask for guidance on how to use them safely. It's also important to note that indapamide may interfere with certain lab tests, potentially causing false results. Make sure that all lab personnel and your doctors are aware that you are taking this medication. If someone has taken too much indapamide and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It is important not to share this medication with others. While taking indapamide, it is recommended to have lab and/or medical tests to monitor potassium levels and kidney function. It is important to keep all medical and lab appointments and consult your doctor for more details. In addition to taking the medication, making lifestyle changes such as exercising, stopping smoking, and maintaining a low cholesterol/low-fat diet can help indapamide work better. It is important to consult your doctor for more details on how to make these lifestyle changes. Regularly checking your blood pressure and heart rate while taking this medication is also important. You can learn how to check your own blood pressure and pulse at home and share the results with your doctor. If you forget to take a dose of indapamide, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and take your next one at the usual time. Don't try to make up for the missed dose by taking extra. Make sure to store indapamide at room temperature, away from light and moisture. Do not keep it in the bathroom, and be sure to keep all medications out of reach of children and pets. When it comes to disposing of indapamide, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you have any questions about how to dispose of indapamide, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.